Hi, it's NP Kami. Now today I'm going to be talking to you about peripheral artery disease, also known as PAD or P.A.D. And this also is another common condition that affects a lot of individuals. How much individuals are we talking about? In the USA alone, it affects over 22 million individuals. Now, what is peripheral artery disease? That is the narrowing of the blood vessel or arteries in the extremities, whether it be in the hands or the feet. The lower extremities, however, are the ones that are predominantly affected by peripheral artery disease. It affects about 10% of individuals in the upper extremity. Now, what causes the narrowing of these blood vessels? The narrowing is usually caused by plaque buildup or atherosclerosis, and therefore you can see there is a link. Chances are, if you're having that happening to your lower extremities, you're probably having the same thing happening in the heart as well. Now, what are the risk factors? Risk factors include those with diabetes, those with hypertension, those with high cholesterol, persons who smoke, persons over the age of 65, persons between 50 to 64 with a history of diabetes or one of the risk factors for atherosclerosis as well. And another risk factor is family history of peripheral artery disease. What are the symptoms? Oftentimes, the symptoms of peripheral artery disease is sometimes confused with like arthritis or even neuropathy. However, this pain, it seems to come on more when you are walking or climbing. It can also wake you up from your sleep. So the pain is intermittent but lasts a little longer. You'll also notice that you might have the affected extremity being colder than, say, the opposite one, or if you compare it to the extremity, the temperature in your arm, your legs feel much cooler. Another thing that you'll notice is poor wound healing. And another thing that can happen is poor nail growth. The nail growth is dark or thickened. Another thing that you might notice is that the hair on your lower extremity is not as much when you compare it to before or to the other extremity that's not affected. Another thing that can happen is the discoloration of that extremity. So in Caucasian individuals or fair-skinned individuals, it might have a bluish or pale discoloration. But in persons who are African American, it might tend to have a purplish, darker color hue in comparison to the rest of the skin. So now we're going to be talking about treatment of peripheral artery disease. And it includes lifestyle changes. What do I mean? Diet. Low fat, low cholesterol, low sugar diet, well balanced, filled with lots of fruits and vegetables. Another one is smoking cessation. Yes, you have to stop smoking. Another treatment, which includes lifestyle, is increased physical activity. It's very important that you are exercising because exercising plays a role in you breaking up fat. It also increases your circulation and helps to manage your diabetes as well. Another treatment factor is medications. Medications more so to manage your chronic diseases. So you might be on anti-cholesterol medication, you might be on antiplatelet medication or anticoagulants, such as, persons might be on aspirin, some persons might be on, say, atorvastatin, whatever your medication to control your chronic diseases along with treatment for sure medicine. Another thing is managing your diabetes, very important. And And that also includes the same lifestyle changes that I've mentioned: diet and exercise, as well as taking your diabetic medications. If all those fail, the next resort is for surgical intervention, which includes a angioplasty, which is opening of the blood vessels, or a bypass surgery. And for that, you'll be referred to a vascular